The Six Nations elected council has been working closely with public health officials and other levels of government to monitor and respond to the unfolding global Covid-19 pandemic. Today, the Government of Ontario declared a state of emergency across Ontario. This follows the Six Nations elected council's own declaration on March 12th. We are encouraging both levels of provincial and federal governments to work with us and all First Nations closely to align our resources and maximize our supports to curb the spread of the virus into the Six Nations territory and beyond. Since entering our own state of emergency last week, we've already begun working with our partners on the ground, identifying priority areas and resources measured we need to execute within them. Today, I'm joined by representatives from the community's essential services that have been working with us day and night to keep Six Nations citizens safe and secure. Thank you for joining us today, and offer thanks to you and all of your colleagues who have been working so tirelessly and selfishly to keep us safe. We have representatives from Six Nations Fire and Police. I'd like to provide each of them with the opportunity to discuss the roles each of their organizations play in the current state of emergency and any helpful advice in keeping Six Nations and its residents safe. First, I'd like to turn it over to Chief Matt Miller to respond. Can you tell us about who Six Nations residents should contact in the case of different emergencies and when it's appropriate to use 911 as the emergency lines?
At this time, we'd still like for the community to know that they need to maintain contacting 911 for anything that they perceive to be emergency as far as life safety, property damage, fires, so on, security. If you contact 911 and explain what your issue is, they will put you in contact with either police, fire, ambulance, and will be able to respond appropriately.
Thanks, Fire Chief Matt Miller. Joining us also is Six Nations Police Services Dave Smoke. Frontline workers would like yourself working directly with community may not have the ability to keep their distance. Can you let folks know how you can keep frontline workers and themselves safe?
Thanks, David. So for police, if you do have to call police or you do encounter the police in the community, just know that police services will continue and are continuing 24 hours a day, 7 days a week. If you do have to encounter the police or have them come to your home or see them in the community, we would ask that you cooperate with police with their directives, what they're asking you to do. If you do have to have police in your home, again, just keeping that self-care for yourself and keeping yourself safe as well. We would ask that you just cooperate again with the police. And for our police station, even though it is still open and business remains as usual, we would ask that you self-assess, and if you don't need to attend the police station, you could always call the police line, the non-emergent line of 519-445-2811, or the admin line of 519-445-4191, or if it is an emergency, like Chief Miller said, 911 is also available to you as well.
I'd like to now introduce Lori Davis-Hill, Director of Six Nations Health Services, who is also here with us. Here we'd like to talk about social distancing. Can you let us know what it is and what measures we can all take to stay safe?
Scano, we have recommended social distancing for our community. That means that we are avoiding groups. We also want people to stay at least 2 meters from each other when they're interacting. Make sure that you're screening yourself for any symptoms such as fever, cough, shortness of breath before going into a public place. If you are asked to self-isolate, that means you need to stay home, limit the number of visitors in your home, avoid contact with others, keep your distance, cover your coughs and sneezes, wash your hands frequently, and wear a mask over your nose and mouth if you must leave the house to see a healthcare provider or when you are in contact with other people. We have updates going out regularly on our Healthy 6A Facebook page that also explain social distancing, what you should not be doing, what you should use caution doing, and the things that we encourage people to be doing to keep themselves active and healthy at this time.
Effective immediately, Six Nations elected council advises all Six Nations members to exercise social distancing measures by limiting in-person activities. All non-essential social visits, including those with family and friends, are discouraged for the time being. Six Nations health services and emergency services will remain open. Grocery stores, pharmacies, and gas stations will also remain open. Some of the measures we currently have in effect include the closure of all Six Nations schools and recreational facilities until at least April 6th. We have, with the exception of those providing essential community services, we have instructed all Six Nations elected council employees to work from home until at least April 6th. We will be conducting Six Nations Council business through virtual channels as well as web-based platforms. The suspension of Six Nations public work fees until further notice, and the establishment of a COVID-19 assessment center and emergency response line are currently in the works. We will continue to work with Ohsweken public health officials to provide Six Nations residents with important and regular updates through channels like Facebook, our website at www.sixnations.ca, and virtual and physical community updates like pamphlets and radio updates. I encourage you to visit the website, sixnations.ca, and our Facebook page for important information on COVID-19 and how you can protect yourselves and all Six Nations residents from it spreading, including a video from yesterday where we were joined by Deborah Jonathan, nurse in charge at the health center. We are all responsible for the health of our community. Together we can protect the health and safety of everyone. Nyaga.